welcome y'all. We are very excited to have this conversation with Jemila Medley about pelvic floor therapy, the connection to breast cancer. We'll be talking all things diastasis recti, core healing, and just core function and life function as well. So, Jemila, would you mind giving us a brief background about yourself? Let us know all your credentials, expertise, and then we'll dive into the conversation.
Yes, I'm so glad to have this conversation and to talk about all these things. I'm a pelvic floor occupational therapist, a pre and postnatal exercise specialist, and a diastasis recti expert. I'm also a mom of 3. And before I became a pelvic floor therapist, I worked in oncology rehab. So I worked primarily with women post-op, lumpectomy, mastectomy, so many different things, different types of cancer rehab, men, women. So, I think where pelvic floor and oncology collides, I feel like I have a very unique background and perspective with.
Yeah, for sure. So I have known Jemila for, oh my gosh, 4.5 years-ish now. That's crazy. That's crazy. 4.5 years. I was talking to her on Instagram and ended up finally reaching out to get started on my core healing postpartum for my first pregnancy. And have worked with her since, prepared for my second pregnancy. We worked through my second pregnancy. So I'm excited to have her in my corner along this journey as well. So yes, let's dive into the questions. I can talk more about how I come to this situation, I guess, if you will, as we go along. So the first question, Jemila, can you talk to us about what pelvic floor therapy is and how it's related to breast cancer? Why should breast cancer patients care about pelvic floor therapy?
Yes. So your pelvic floor is a house for your major organs. So it sits in your pelvis. Do you mind if I get my pelvis model?
Go ahead.
This is right over here, but I do have to move to get it.
Yes.
Okay. So this is your pelvic floor. All of these red muscles are pelvic floor muscles. They wrap all the way around to your glutes. So it's not just your external vaginal muscles that everyone thinks about when you think about like, oh, do a Kegel or contract those muscles. It's more than just these muscles. There's also so many layers internally of your pelvic floor. So again, for pelvis, and then the pelvic floor is the hammock or the house inside of your pelvis. So it's a group of muscles. And when we start thinking about the pelvic floor as a group of muscles rather than this like static thing in our pelvis, then we think about it differently. And so pelvic floor therapy is the rehab of those muscles. So just as we rehab our shoulder from a shoulder rotator cuff injury, a knee replacement, all these other things that we have rehab for, our pelvic floor also needs rehab. And more specifically, when there has been some degree of trauma, because the pelvic floor is that house for your major organs. That's your bladder, your uterus, your bowels, your small intestine, large intestine. And as there is shifting or adjusting during pregnancy, during postpartum, during menopause, during hormonal shifts and changes, life changes and stressors, as well as other traumatic factors, we need to rehab those muscles. And so in pelvic floor therapy, we focus specifically on those group of muscles, but not just those muscles, how those muscles connect to everything else to help you long term.
Yeah, that's so good. Especially with thinking about the connection to breast cancer patients and the different, subtypes of breast cancer, the hormonal shifts that induce menopause, that people with hormone positive breast cancer have to take those, you know, those drugs and things that put them in that space. And then they begin developing these symptoms, not really understanding or knowing, you know, the why behind it or how to help and make things better. Um, so we know that pelvic floor therapy is needed, but there have been so many conversations. I've seen it in my own, like, you know, breasties group chat where they're like, what is pelvic floor therapy? I've never heard of that, just in general. So why do you think pelvic floor therapy isn't offered, you know, in conjunction with after breast cancer treatment and surgery?
I think it's one of those things in regardless of what the diagnosis is, that is on the back burner, because to most physicians, surgeons, providers, primary providers that you're seeing, they're just focused on, is the area not infected? Can you move? And doesn't matter if you're restricted in movement, as long as you can move, you don't have an infection, your sutures are healed, and your cancer is decreasing. They're focused on those things. So your functional wellness is not a priority. And while I understand they have a specific focus, there are specialists, pelvic floor therapists, who could be outsourced or who could be a referral source. In certain areas over others, you know, in certain states and locations, there's more advocacy and education and collaboration. And one of the first places that I ever worked was at Baylor Scott and White Rehabilitation. And they have a significant oncology rehab program called Revital. And they also have a massive like women's health team of pelvic floor therapists focused on this. And there's a lot of collaboration. Like we would have meetings with oncologists, surgical oncologists, surgeons, you know, reconstructive surgeons and OBGYNs and urogynecologists. And we would have like collaborative meetings with these providers. And I've never seen that anywhere else that I've worked, where doctors are collaborating with other types of providers that they can refer to. And so I think, you know, women are just not getting referred, especially with breast cancer, because there's so many things on the list that their highest priority, which rightfully so, is to make sure that your cancer
Mhm.
is removed, you're responding well to the treatment, and you're not
Yeah.
having an infection, and
Yeah.
you can move on. But when we think about your quality of life and your
Mhm.
long-term function, the hormonal changes are huge. I mean, just thinking about getting back into intercourse and feeling more comfortable in your body, having increased movement, because there is a lot of restriction,
Mhm.
especially after breast surgery,
Yeah.
that this restriction up here restricts your pelvic floor and your core movements. So, you know, it's a full holistic, full circle thing, but most traditional providers aren't looking at you holistically.
Yeah. Yeah. So can you talk about, can you have pelvic floor issues if you haven't had a baby?
Yes. Most women, in my experience, in my practice, most women have reported to me and other therapists that I have worked with that their pelvic floor issues started before they had a baby. They either were embarrassed by it and didn't want to speak up about it, or they did not know that it was an issue. And so then, as soon as they got pregnant, now we have this big flare up of peeing when they sneeze, or having increased back pain, prolapse, pain with intercourse, that all started pre pregnancy and then got worse during pregnancy into postpartum.
Yeah. So I know you talk a lot about this on your Instagram. So I'm gonna let you have your soapbox moment for a minute, right? how is pelvic floor therapy different than just doing Kegels? Because I remember when I was on the YouTube trying to learn on my own, that's what I found was to do all these Kegels. When I was picking up Jackson, laying throughout the day, early postpartum, do 50 Kegels a day. That was what I saw. So can you talk to us about how it's different and why pelvic floor therapy is more extensive than just doing Kegels?
Yes. Okay. So, first, over the last 3 years, what I have learned is that there are pelvic floor therapists out there who are pelvic floor therapists, but still will prescribe you Kegels, unfortunately. So, if anyone is listening to this and they're like, well, I did see a pelvic floor therapist and she told me just to do Kegels, Kegel on the ball and Kegel at the stoplight and Kegel all day long. The difference between functional or more holistic pelvic floor therapy compared to your doctor or therapist just being like, oh, just do Kegels, is that we're looking at every part of your body and its connection to these tight or weak pelvic floor muscles. When you do a Kegel, we're getting contraction, contraction, contraction of these muscles. And yes, there are therapists that are like, well, then I have them relax. And okay, cool. They're contract, 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 and then they just relax. That is not a functional movement. So when we think about like a bicep curl, if you are contract, 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 and then, oh, let me relax, but I'm not relaxing with functional movement, then your bicep isn't going to be able to fully extend to reach functionally to grab something, to handle the load of something heavy. The same thing applies to your pelvic floor. So a lot of times with Kegels, there will be this short-term relief or short-term improvement. And people are like, oh my gosh, I did all these Kegels and now my pelvic floor is better. And in 6 months, they end up in my office and say, well, I was doing those Kegels and everything got better. And then suddenly it just got worse because your body needs to be able to relax and lengthen through all of those pelvic floor muscles, just the external vaginal ones. And also contract, but stabilize you, not contract and hold. It needs to contract to stabilize you up through the pelvic floor into the core. And that's where there's a big difference between doing Kegels and seeing a pelvic floor therapist, because in pelvic floor therapy, not only are we working on connecting your breathing, your everyday breath with your pelvic floor contraction and relaxing. Now we start to work on other areas like your inner thighs, your abdominals, your glutes, your quads that are all really tight, your upper body, your jaw. And as we start releasing, manually working on releasing those areas, then your pelvic floor starts to have better function. And then we transfer that into exercise that's going to fit your daily routine and the things that you already have to do. So it's just a long-term benefit to really connecting to those muscles.
Absolutely. As someone who is, I guess I'm still technically postpartum or 2.5 years, newly postpartum or still postpartum, dealing with diastasis recti, I feel the pain, right? Like in just bending down at the tub to give my daughter a bath, trying to, picking up a 30-pound toddler. All of those things, those kind of daily, wanting to get down on the floor and play with him or whatever, and trying to get up off the floor. Like you don't know and don't understand how how everything is connected in the body until you go to do something and you can't do it. And you're like, why? And I think for people that aren't, familiar with pelvic floor therapy, with the pelvic floor, you don't think about that as being a source of why, things aren't feeling right in your body. So this has been a very informative session on just educating us on what pelvic floor therapy is, why it's important for breast cancer patients, and just being able to kind of seek out those resources and tools on our own. If we do know that it's available, we do know that it's necessary, we can seek those things out on our own to really create a more holistic plan for ourselves, even if it's not the primary thought process of our doctors and oncologists. So thank you so much.
Yes, you're welcome. And how during just your journey and your experience have you felt like, because you've worked a lot on your pelvic floor prior to your diagnosis, do you feel that you had more of a benefit in this healing journey of like that mind body connection?
Mhm.
And because I think that's something that is easily frustrating. And
Mhm.
especially now you have you have this diagnosis, you have all these emotions, and your body feels the weight of that. But having had pelvic floor therapy prior, did you feel
Absolutely.
any like difference?
I did. I do believe that had I not known the things that I know, like I learned from you, even the chiropractic care, that came from you. I didn't know anything about chiropractor before I started working with you. So knowing I feel this in my neck, or I feel this in my, lower right back, that this is my sciatica because I've been sitting for so long. Let me get my lacrosse ball and sit on that. So still having those little tools that I could kind of reach for, even if I couldn't, get down on the floor and do, my exercises, even if I couldn't go for a walk or whatever that those things were. I do think I was in a better position, I think mentally, and like knowing the tools. Um, however, but because I was postpartum. I was 17 months when I was first diagnosed. So I didn't use that first year to do the work that I was supposed to do. And so I do not be like me. Like do what you're supposed to do. I think I was just I don't know. There's so many reasons, right? So I was already dealing with the diastasis from that pregnancy. And so it was kind of, for me, it felt kind of compounded. And then I found out through images and things that the diastasis was like 10 centimeters, like it was considered very extreme and all of this. And I'm like, okay, that makes sense. Because I'm looking at myself in the mirror and I'm like, why do I look so pregnant? Like I know I need to lose weight, but like why do I look still so pregnant? Um, and so, in hindsight, I wish I would have done X, Y, and Z. So I would have been like physically in a better position or a different position going into breast cancer. But I think knowing what I know and having the education that we've worked on all these years, and it's now ingrained in my mind. I know what I need to do when I feel certain things in my body. I know, yeah, I can stop going into the details, but yeah, I know what to do when I feel certain things. I know how to respond. I know what to reach for. I can say, hey, I need to go to the chiropractor. I need to do some pelvic floor therapy exercises. I need to stretch. um, I need to sit. I'm sitting on my, my yoga ball at my desk. So those seemingly little changes in how I operate throughout the day, in my home, in my car, make a difference in how my body feels open.
Mm, that's good. And I think that's a testament to um, being proactive about things, because we
Mhm.
never know what is gonna hit.
Yes.
There's so many things we just don't know.
Hmm.
That's why I highly encourage anyone watching this to, even if you don't think you have pelvic floor issues, or you think, oh, nothing will happen, I'm healed, or everything's fine, or still seek the guidance. It is still just so valuable to learn
Hmm.
more about your body. And I've had other clients, other women that are close to me, who have been diagnosed with different types of cancers and other diagnoses. And one of the things that I hear a lot is, I was so in tune with my body that I
Hmm.
knew that something was off to
Hmm.
go get this checked out.
Yeah.
And I think pelvic floor therapy is just an open door to learn more about yourself. So,
Yeah. Absolutely. Oh, I was thinking about something. Oh, I think the other thing with that is, to your point about being proactive, in my mind during that postpartum season, I was like, I just don't have the room. I don't have the room and bandwidth to like focus on this right now. Like this is what's most important. So putting myself on the back burner, not instead of putting myself like at the center of the things and like this will actually like carving out this time, even though it feels like you don't have the time, carving out that time for yourself will help you be able to do all of these things well around you. And I mean, I think that it happens because I mean we're in the thick of postpartum, thick of a baby, trying to just 3 kids, all the things. So it's very easy to do. And I think we have to, as women, we have to fight to remember that our physical, mental, spiritual health is very important to us doing all of those other things that we're trying to accomplish.
Yeah. Yeah, that's good.
Yeah. So thank you again. This has been great. We're going to come back with more information around specifically kind of reconstruction. For me, I'm doing the deep flap. So we're going to talk more about that and what that entails and how pelvic floor therapy helps in preparation for, but then also in recovery. So thanks. Stay tuned.